Welcome to the Taking Care of Tutu podcast. This is our first episode of season 2. I'm your host, Meg Openoff, and we're so happy to have Casi Saranillio on the podcast with us today. She's a nurse and she's the stroke program manager at Maui Memorial Medical Center. Welcome, Casi. We're happy to have you.
Thanks, Meg. I love spreading the word about stroke in the community, so this is a great opportunity. I appreciate it.
Awesome. So for lots of us who don't know exactly what a stroke is, will you explain what it is?
Sure, no problem. So I'm going to share a screen here that will kind of help with the visual. So I just want to make sure that you can see that.
I can see it.
Okay, perfect. So there's a couple of different types of stroke. There's two to be specific. There's the clot type stroke, which is the first one on the left side of the page. And then there's a hemorrhagic type stroke that's on the right side of the page. By far, the most common is the ischemic stroke or the clot strokes. So those are the ones that we see like the pre-traumatic symptoms with, that kind of thing. So hemorrhagic strokes make up only 13%, but they are more deadly. So more people do die from hemorrhagic strokes than from clot type strokes.
So a clot type stroke would be a blood clot develops in some other part of your body, and then it blocks off a blood vessel that's important to your brain.
So you can get a clot in your brain that way. You're right. It can travel, or it can also form stationary in your head too. So it can form right there in your brain. So
that's called ischemic.
Ischemic stroke. Yep. Okay.
And then the other one, hemorrhagic, like hemorrhage. So that's when something ruptures and then blood spills into the brain.
Yeah. And you've heard of an aneurysm, I'm sure. Yeah.
Yes, of course.
So that is one of the ways that you can develop a hemorrhagic type stroke. It's about half of the time of that 13%, about 7% of those are aneurysms that rupture. And then that turns into a stroke once aneurysms rupture. But people can live their whole life having aneurysms, not even know it, and then they don't rupture because they don't have extremely high blood pressure. They don't have those risk factors. And we can talk about that in a little bit today.
What are some warning signs, like for caregivers, for spouses? Like, how do you know if something like that is happening?
Sure. So I'm going to take you to an acronym called LifeSaving. You can see that here. So this is something that we teach in the community, at schools, our kids. These are the most common signs and symptoms of stroke. So when we think somebody is having a stroke, we'll look for these signs and symptoms. Even at the hospital when they arrive, we use this acronym. So that is a sudden change to the balance. And all of these symptoms come on suddenly for stroke. This is something that they haven't had before. So you'll know because they had the way they were before, then all of a sudden now they have this sudden change. So a sudden change in balance, a sudden change to vision. At any change, it can be double vision. It can be a loss of vision in one eye, but it's new and it's sudden. I think the most common one that people recognize is the facial droop, and it's always on one-sided facial droop. One side of your body, your arm, leg, or both become weak, or you get a really sudden numbness and tingling in that area that you didn't have before, but it's always one-sided. It's either the upper and lower or both. And then a sudden change in speech. It can be slurred speech. It can be the change in the way people understand you. All those things. It can be either the way that they're communicating or the way that they understand, but it's sudden. And then the teeth transferring time, and that's just because we need to get to the hospital right away because there are some things that we can do, especially for the ischemic stroke patients. I'm just gonna
interrupt you there for just a second because not everyone's gonna be seeing. Like a lot of people are just listening to this on audio, so I want to recap. It's Be Fast, or I guess Be Fast is the acronym, and so it's balance. Eyes, meaning vision loss. Face, look for an uneven facial expression or smile. Arm, if an arm or leg is weak. S is for speech. And then I think what you were just starting to talk about is like why timing is so critical.
So timing is really critical because your brain cells die at a rate of 2 million per minute once those stroke symptoms start.
So that is a shocking number.
Yeah. And I need all the brain cells that I have. So
100%.
Yeah, it's absolutely real critical to get people here really quickly. There's something called the core injury of a stroke, and that's the immediate tissue that begins dying. And then you have, it's almost like a target, right, that surrounds that tissue. And that just that tissue that surrounds that little infarct zone, that's tissue that has a lower amount of oxygen than the healthy part of the brain. So if we can get the clot out, we can save that part. It's called the penumbra.
How how can quick action when you suspect someone's having a stroke, how can that affect their long-term outcome?
Yeah. So one thing, I'm showing a picture right now where it shows that when I talked about the infarction core and the penumbra, it's like a
Mhm.
target, right? So timing is everything. So
In her picture that she's showing right now, there's like a really small, circle in a brain that 30 minutes, and then it gets bigger at 2 hours, and at 12 hours, it's quite large, taking up a lot of the brain.
and that's what we want to try and preserve. So when people come to the hospital, we can't reverse the death that's already happened. That's a key thing for people to remember. Once those brain cells have died at 2 million per minute, we can't get them back. But what we can do is save the area that's in danger when they come in, that's having a low amount of oxygen, that if we don't do something about, it's going to die too. So that's our goal when people come in, is to reduce the disability that comes along with stroke. And so there's a picture at the bottom that actually shows what happens right when a stroke starts at 1 minute. And there's really not much death there until 15 minutes. You can start to really see where it's a small little area, but it's starting to grow. 15
Yeah.
minutes later, it's doubled in size. After 1 hour, it's almost tripled in size. And in 2 hours, it's very large. In 3 hours, it's almost taken up that full section of area where you have the danger zone. So what our goal is we can do something if you get here within a few hours, within that 3 hour zone, we can do something about it. But if you wait till after that, it's too late. And they call that stroke completed after that, or it's evolving to the point of completion. Well, we can't do anything about that because it's already grown so big that it's killed off all that tissue that we wanted to save.
And I think that's a really important message because I think we're socialized. We don't want to bother anyone, especially if the senior is telling us, no, 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 I don't want to go, which a lot of them are going to be saying. And it feels like a big step to say, I know you don't want to
Yes.
go, but I'm calling 911 anyway.
Yeah, exactly. And that's one of the things that we see here too, is sometimes people will, the older people will have symptoms. They'll think if they take a nap that it will get better. They'll take a
Oh,
nap, and after several hours, they won't come for 5, 6 hours, even more. Sometimes the next day, sometimes they'll go to sleep. Because the thing about strokes is that they don't hurt. So that's why
yeah.
people come in for strokes a lot of time. They don't usually hurt. The only type of stroke that hurts is when it is the bleeding type stroke, because people get a headache. They get the most terrible headache they've ever had.
And
And
then they'll come. Yeah, they'll go to,
come through
yeah,
that because that's pain.
right.
That's a bleeding kind of stroke. So that one, we're not so worried about people not coming in for that one, because they will, because it's very painful.
Yeah.
But these, the main type of strokes, people will try and take a nap and try and make themselves better. It doesn't work, but by the time they realize that it is time to go to the ER, that chance that they had to save that brain is already gone.
What's one thing you wish everyone knew about stroke prevention or stroke response?
I think this, that understanding that time is one of the biggest factors when it comes to stroke. Stroke is one of the conditions that if people knew that they had a very small window to get help, if they appreciated that more. Because I'll tell you, I think pretty much nationwide, the statistics is only that about 12% of patients are able to get treated with that blockbuster in hospitals, because most people wait too long. So if we
Wow.
could get more people treated with that blockbuster, then more people would have a better recovery. So I think just having people understand the time factor is so big with stroke. If we can get you treated more quickly, you can save all those millions and billions of brain cells.
Amazing. Okay. Any final thoughts you want to share with us?
Just, take care of yourself. Do all those healthy things that people tell you to do, because there's a scientific reason behind it. And what prevent stroke. I know sometimes it's hard, but small steps is the key to really at maintaining those good healthy habits. So
And for loved ones and caregivers, trying to encourage your person to go out, to see other people socially, to try new things. That's a good job for a caregiver to try to encourage.
absolutely, it will have multiple benefits other than helping increase your chances of getting disabilities back. It also helps increase your endorphins. That helps and improve moods, that kind of thing. So it's good all around for people.